about Alcoholics Anonymous primarily, but this is not too different from any of the 12-step programs. AA, of course, is without question the largest, and therefore that's the one we're going to spend the time with. So the objectives today are to become familiar with the history of AA and how it has evolved to what it is today, and to understand the different types of meetings that exist, understand how meetings are structured, and to understand some of the common obstacles to AA in MAT, and for participation in MAT, and how to approach these obstacles in a clinical setting. And then the next month, I'm going to have another talk. It'll talk about more of how AA works, what sponsorship is all about, and what the 12 steps are all about. I have a disclosure. I am a very, very strong advocate of Alcoholics Anonymous. I have attended well over 2,000 meetings since my intervention for opiate and alcohol addiction in October 1990. And I do attribute my success in maintaining continuous sobriety for the past 29 years, 4 months, and some odd days, about 21 days. I attribute this to private counseling and to Alcoholics Anonymous. AA has helped me experience a vastly better quality of life than I could have ever imagined possible before I started traveling the road to recovery. So why AA? Why 12-step programs? I'm not going to go through the Ohio Administrative Code, but suffice to say that unless there is documented reasons to the contrary, there has to be some form of counseling for MAT patients. It's required. And if they don't want to do formal counseling with a professional, they can go to 12-step meetings, and it's our obligation to document their participation. So let's talk a little bit about the history of Alcoholics Anonymous. Alcoholics Anonymous was founded in 1935. However, before that, the only real organization that existed was the Oxford Group. The Oxford Group was originally founded in 1921 by a Lutheran minister. When it was founded, it was called a First Century Christian Fellowship. In 1931, they changed the name to the Oxford Group. The Oxford Group's philosophy is rather interesting. It's pretty hardcore Christianity. All people are sinners. All sinners can be changed. Confession is a prerequisite to change. The change can access God directly. Miracles are again possible, and the change must change others. So these are their philosophies. There was 4 standards of morality in the Oxford Group, the 4 absolutes, honesty, purity, unselfishness, and love. Now, Bill W. and Dr. Bob formed AA. To give a little bit of history, Bill Wilson was a stockbroker in New York City. He was a big-time alcoholic. He tried many, many times to dry out, to stop drinking. He was unable to do so. He was hospitalized numerous times to sober up, and he just couldn't stay sober. He was finally referred to the Oxford Group and miraculously did get sober, and he was doing fairly well. In 1935, he had to go to Akron, Ohio on a business trip. And I guess the business trip didn't go very well because while he was there, he had a very strong need to drink. And he knew that if he couldn't hook up with another alcoholic and try to help him, that he was going to relapse before he got home. So he reached out to some local ministers, and they ultimately referred him to Henrietta Seiberling. Henrietta Seiberling was a very active member of the Oxford Group and believed very strongly in it. She was not an alcoholic, but she believed in the principles and the absolutes of the Oxford Group. She felt that the person that would be best for Bill W. to talk to was a friend of hers, Dr. Bob Smith. Now, Dr. Bob didn't want to do it, but no one says no to Henrietta Seiberling. Henrietta, just to let you know who she was married to Frederick Seiberling, who was the son of Frank Seiberling. Frank Seiberling was a little inventor. He invented a tire making machine and the wheel rim. He also co-founded a little company that perhaps you've heard of called Goodyear Tire. And he made some money and he built the building that you see there. That is Stan Hewitt Hall. That is his home. He built it in 1910 and his family lived there. Henrietta married the son and divorced him. And her children remained in the house with the father, and she moved to the gatehouse. And so that's really where she lived. There was an apartment in the gatehouse for the estate, and that is where the meeting took place. If you haven't seen Stan Hewitt Hall and you're in the area, you need to. It is gorgeous, and please visit the gatehouse because the history of AA is all over it. So Dr. Bob said, I'll meet for 15 minutes. Well, the meeting went 6 hours, and essentially AA was founded. What they did when they first started out, they would team up, they would actually perform a mini intervention on an alcoholic whose family would have contacted them, given them history, told them what was going on, told them what they needed done. And then what they would do is they would sort of gang up on this guy, and it was usually a guy, and try to get him to surrender, to admit powerlessness, and eventually go with them to Oxford group meetings. Bill W. realized that in order to remain sober, an alcoholic needed to help another alcoholic, and that by postponing a drink for 1 day, 1 hour, even 1 minute, it was possible that an alcoholic could remain sober. It took them several months before they finally had 4 members, and that included themselves. So when they finally literally had 4 people, including themselves, Bill W. felt that he could go home to New York. And he basically went back to New York in the fall of 1935, formed his own group up there that met in his home. In the meantime, the 3 other members continued to go to the Oxford group meetings and continued to talk to alcoholics. But Dr. Bob went a little bit beyond that. What he did was he invited alcoholics to live in his home. And he, in essence, established the first halfway house in the United States. He also established a relationship with Sister Ignatia of St. Thomas Hospital, which is still in Akron. It's a Catholic hospital. And in the next 10 years, about 5,000 alcoholics were admitted to Ignatia Hall, which is the treatment center at St. Thomas. And in the process of drying out, they learned about AA. When Dr. Bob died in 1950, Sister Ignatia left St. Thomas, moved to Cleveland, and established the second treatment center in the United States, Rosary Hall, at then Charity Hospital, which is now St. Vincent Charity Hospital. In 1937, Bill W. broke away from the Oxford group. I don't know what happened, but he broke away, and in 1939, the Akron group also broke away. So they no longer took their recruits or members, whatever you want to call them, to the Oxford meetings. They had their own meetings. As the membership grew, it was very, very clear that they needed something in writing. They needed some direction. New members needed to understand what AA was, how it worked, and what to do in order to become sober. It was important. So in 1939, Bill W. wrote the big book, of Alcoholics Anonymous, and it was entitled Alcoholics Anonymous, and that's where the name Alcoholics Anonymous for the group came from. The book was divided into two parts. The first part was the first 164 pages, and the second part was the balance of the book. The first 164 pages really contain directions on how to get sober, how, it contains the 12 steps, how it works. It describes really the philosophies of Alcoholics Anonymous. The balance of the book are personal stories that were updated with each subsequent edition so that they could be more timely for the people that were reading it. And as you can see, and of course the book was rewritten as you see there in 55, 76, and 2001. AA grew from 100 members in 1939. It grew to 2 million members in 2001 and basically leveled off at that point. Now keep in mind, AA doesn't keep formal membership lists, so all these numbers are rough estimates. No one really knows how many people are in AA, and of course, people go to multiple meetings. So, how do you count them? How do you keep track of all of that? But what we do know is in 2019, Alcoholics Anonymous was in and is in 180 nations, the majority of which are not Christian nations. There are 118,000 AA groups in the world, and of the AA membership, 1.3 million are US citizens and 100,000 are Canadian citizens. So I want to talk a little bit about some of the most important founding principles of AA. The first one, AA has to be financially supporting. The power and influence of AA is not in its financial wealth, but in the many members who carry the message to alcoholics who are still suffering. Not because they gain something financially, but because they get a reward for helping someone else. Because AA is self-supporting, it does not advertise. It does not operate treatment centers, which it could very easily have done. It refuses to endorse any products. It refuses to endorse any political candidates or any issues. There are no dues, there are no fees for AA. There are small donations that are collected at each meeting, which are used to defray rent expenses, purchase refreshments and AA pamphlets and other necessary things for the meeting to run. Another founding principle is being non-professional. And this is something that some treatment programs and some addictionologists have criticized, and they don't affiliate themselves with a 12-step program because they are non-professional. They feel that there should be professional addiction specialists as part of the meeting to make sure that things are going the way they should be going. But the way AA works, it's one alcoholic helping another alcoholic. An alcoholic who gets sober, who is non-professional, who has no medical knowledge, the only thing he knows is what he did to get sober. He knows what worked, and he will use what worked to help someone else. So it's non-professional, but it's not unprofessional. It's non-professional, but it's effective for the individual and hopefully for the person who's being helped. And the last thing I wanted to talk about was anonymity. Originally, anonymity was absolutely essential. Bill and Bob needed it to be anonymous because they weren't sure that what they were going to try to do was going to work. And they knew that even if it did work, it wasn't going to work on everybody. And a couple early failures could really harm the group, and they didn't want that to happen. So they maintained strict anonymity, and that allowed members to avoid the social stigma of being labeled an alcoholic. If membership was disclosed and its members, then the members wouldn't have a safe haven. They wouldn't have a place where they could go and they could be themselves and be understood by other people with the same exact problems that they had. It also prevents alcoholics from seeking fame and fortune at AA's expense, and it helps keep members humble, which was felt to be essential in promoting sobriety. Now, there's three major types of meetings. The first type of meeting is the meeting that everybody knows about, because if you've ever watched television or gone to movies and you see an AA meeting, you always see somebody standing up in the front and he's giving his history and he's telling all about all the things he did and how wonderful sobriety is, et cetera, et cetera. Those are speaker meetings. What happens in a speaker meeting is the speaker is selected in advance, and he is supposed to give a 30 to 40-minute talk. Ideally, the talk should have three parts. One, it should have the events of his drinking or using life. And then it should contrast that to what is his life now in recovery. But the third part, which is also important, is how he got from A to B. What did the AA program do? How did working the steps help him grow in sobriety and lead him to where he is today? The speech is supposed to offer hope, strength, and support. Everywhere except in Northeast Ohio, there are no exclusive speaker meetings. In every other area in the world, meetings are all discussion meetings, and at an anniversary of the meeting, or if there's a special day, say one of their members is having his 40th year in sobriety, so they're going to invite a speaker, they'll have a potluck dinner, they'll have a big deal about it. And the speakers, because they're well known to have given good leads, solid, entertaining, informative, these meetings are very well attended, and they're actually very, very good. But in Northeast Ohio, because of the way Dr. Bob and Bill W. worked to start AA, it was telling the story, telling the story, telling the story. And so there are meetings, approximately 350 meetings in the Cleveland area, Cleveland-Akron area. There's 350 meetings a week that are strictly lead meetings. Every week there is a lead. So if you multiply 350 times 52, you get 18,200. So a city or a metropolitan area of Northeast Ohio would need 18,200 leads to operate all these lead meetings. Well, needless to say, all 18,200 are not great. And some of them are just glorified drunkalogs, where they just talk about all the horrific things that happened. And sometimes they're very hard for people to really appreciate and identify with. So for the most part, I have my patients, since I'm in Northeast Ohio, in Cleveland, I steer them away from lead meetings as much as I can, and ask them to go mostly to discussion meetings. So the types of discussion meetings. The major discussion meeting is a meeting whereby the secretary, who's annually elected by the group, appoints 12 different people to be the chairperson for the month. So there's 12 different chairpersons, each one does a month, and they are responsible for either choosing topics and introducing them, or having someone else choose a topic and introduce it. The topic is introduced, and then 10, maybe 12, 15 people, whatever, are talking and give their comments. The nice thing about meetings, it really, you know, I've been to so many meetings, and I've heard probably every single topic that there possibly could be, and I've heard some of these topics 100 times. And yet every single time I go to a meeting, I learn something, because there are 10 or 12 people that are talking, that are speaking, and some of them are going to say something that I had never thought about. So when I walk out of a meeting, I feel better than when I came. And that's why a lot of people go to meetings. That's why a lot of senior people go to meetings. The other thing that you need to understand, and I have this on the slide, is when someone speaks, like for example, if I was going to speak, I would say, I'm Ken, I'm an addict and alcoholic, and then I stop and everyone in the room says, hi, Ken. And when I finish, everyone says, thanks, Ken. So this gives everybody in the room 3 opportunities to know who I am. So if they have a question or if they want to talk to me afterwards, they feel more comfortable because they know my name. The other meetings that we can talk about are specific areas of study meetings. And these are like, for example, the big book meetings, where they'll look primarily at the first 164 pages. It'll take them, with a few pages a week, it takes them, several, probably 5, 6, 8 months or so to get through the entire 164 pages. There are also step meetings where every week a different step is discussed. There are specific meetings that only the first step is discussed. Now, the first step is considered the most important step. This is the step that has to be done perfectly. This is the step that says we admitted we were powerless over alcohol, that our lives had become unmanageable. Because everyone feels the need to renew a first step, I periodically go to first step meetings. Why? Because I want to just hear the first step again. I want to make sure that what I've got in my first step is good. So there are new people that are trying to learn the first step, but there's also people that have 20, 30, or even 40 years of sobriety going to a first step meeting. And then there's other meetings like 12 and 12 meetings where they discuss the steps, traditions, or promises, and they do that in rotation. Now, one other thing that I wanted to mention is that often in discussion meetings, the chairperson will ask if there's any sobriety-threatening issues before they start the actual discussion topic. And this gives somebody who's struggling an opportunity to speak, and it allows other people to offer help and advice, but more importantly, support. And this is very beneficial to a struggling person. Okay, so when we talk about classification of meetings, there are 2 basic classes. Either they're open or they're closed. An open meeting, anyone can attend. And this is a meeting, by the way, that you guys can attend. If you've never been to an AA meeting, I'd suggest you try to go. You can check online. If it says it's an open meeting, then you can go to it. Any family member, friend, healthcare provider, any interested people, anybody can go to an open meeting, and you simply identify yourself that you are visiting, you're a physician or a provider, and you want to learn about AA. It's not a problem. Closed meetings, however, are meetings that can only be attended by an alcoholic or a drug addict. The only requirement for membership in AA is the desire to stop drinking. And I encourage my patients to go to AA meetings. In Northeast Ohio, there are so many more than there are NA meetings, and also the meetings are better attended. There's more experienced people at AA meetings than there are sometimes at some of the NA meetings. So I do have them go to AA meetings whenever they can, and often after I've obtained a history from the patients, there's usually a history of some alcoholic drinking or whatever, and I also tell them that, remember, they're signing an agreement with me that says that they're not supposed to drink. So there's a lot of reason for them to be able to say that they're members of AA, even if their primary drug of choice wasn't alcohol. They do have a desire to not drink. They have a desire, therefore they can go to these meetings. Meetings are an hour, and usually the more experienced or mature members that come a little earlier, and they're there to greet newcomers so that they can feel more welcome. And there's usually a social hour afterwards where the refreshments can be served and where members can talk, and that's where you can get to know people. That's where you'd find a sponsor, etc. Okay. Meetings are all organized basically the same way. They all open with the serenity prayer. God, grant me the serenity to accept the things I cannot change, courage to change the things I can, and wisdom to know the difference. No one knows who wrote this, but we do know how it entered AA. In 1942, an AA member saw an obituary in the New York Herald Tribune that included the serenity prayers. He brought it to the New York office, which was then the worldwide office for AA. And as soon as people read it, they realized that this was just something phenomenal. Later, Bill W. wrote, "Never have we seen so much AA in so few words." So this was a profound statement in so many words. And all meetings open with it. After that, then there's other things that are read. Sometimes they read a couple paragraphs on how AA works. Some people will read the steps or the traditions or the promises. There's announcements. If there's anyone sick or needing group prayers, those people are mentioned. And recognition of people with an anniversary of 1 year or more are also done for that month. While this is going on, a basket is passed to collect money to defray expenses. And lastly, the meeting ends when the chairperson asks those who wish to stand, hold hands, and recite the Lord's Prayer. Our Father, who art in heaven, hallowed be thy name. Thy kingdom come, thy will be done in earth as it is in heaven. Give us this day our daily bread, and forgive us our trespasses as we forgive those who trespass against us. And lead us not in temptation, but deliver us from evil. For thine is the kingdom, the power, and the glory forever and ever. Amen. Very controversial. Yes, it's a Christian prayer. Yes, it can turn people off. There is no question about that. The use of the Lord's Prayer can be traced back to 1938. It was likely a holdover from the Oxford group, and it describes a very antiquated, chauvinistic, anthropomorphic concept of God. We have this Father who's in heaven, and he can make people sober, and he can intervene in his children's life, and he can keep them sober. And it's through sobriety that the link between him and his children can be established. And the change, as I said, the change can access God directly. Well, as a practicing Jew, this prayer really bothered me when I first started attending AA meetings. But as I grew in sobriety, it became an expression of man's humility, the need to forgive each other, and the power of we in achieving and maintaining a sober life. Initially, I would stand because I was too embarrassed to stay seated, but I wouldn't say anything. However, I think I can honestly say that I have probably recited this prayer at least 1,800 of the 2,000 plus meetings that I've attended. Okay, so what are the obstacles for AA? And I want to try to finish this up because I'm really going too long. The most important obstacle to participation in AA by MAT patients is lack of motivation and readiness to change. The most common perception among new MAT patients is that the prescription is all they need. They feel great after they got the prescription. What do they need more for? And this is where educating the patient becomes absolutely critical. I don't discuss AA with a new patient until after I've got a complete history, until after I've explained to them what Suboxone is, and most importantly, what Suboxone is not. I explain to them about how it works, but I tell them that it is not a treatment for addiction, that it's not like penicillin with pneumonia. You give penicillin, the patient gets better. They don't get their pneumonia again when you stop the penicillin, assuming, of course, they take it properly and it's the appropriate drug. Okay. I ask patients, what happens when someone who's incarcerated comes out of prison? He goes through detox while he's in prison. He doesn't have access to drugs, or he doesn't take drugs while he's in prison. And when he gets out, what happens? Most patients say, well, eventually they relapse, or they relapse quickly. And that's true. A lot of people who leave jail or prison do relapse. And I ask them, why is that? Why do you think that happens? Or if they have a history of relapsing, I ask them, what happened? Why did it happen? And we get to talking about what is the treatment for addiction. And the treatment for addiction is the counseling. It is learning coping skills. It's learning to live a different life. It's learning to like oneself, trust oneself, and respect oneself. And you get that from AA. Another obstacle is cultural obstacles. When Bill W. Started writing the book and putting together AA, he was greatly influenced by the Oxford group because that's what helped him get sober. And the Oxford group's emphasis on spirituality, on surrender, on powerlessness contradicts modern cultural norms of secularism and self-reliance. Fortunately, over the past 80 years, Western culture has begun to recognize the crucial role of social support in promoting physical and mental health, coping with stress, as well as acceptance of external support, including spiritual support upon which AA is founded. And this leads us to the next obstacle: spirituality. My friends, there's no denying that AA is a very strongly spiritual program, but it is not a religious program. Despite concerns over the Lord's Prayer and the fact that God or some variation of God is mentioned in the Big Book 281 times and in the 12 steps 4 times, everyone has to develop their own definition of spirituality. I know what spirituality means to me, but I sat down and I wrote it out so that I could read it to you now. To me, spirituality is the relationship one has with his higher power so that he can gain an understanding of what his higher power expects of him and the confidence stemming from this knowledge to aspire to live up to those expectations. That to me is what spirituality is, and this is what I tell my patients. AA is not religious. If it was, how can we explain how a Catholic and a Protestant, a Jew and a Muslim and a Buddhist and an agnostic and an atheist can all sit in the same room and smile at each other? It's because it's spiritual. It's not religious. And the other major obstacle to participation in AA is, well, let's go on here, is lack of effectiveness. There's no real good, lack of professionalism, first of all. There are some treatment programs that will not send their patients to 12-step meetings because of the fact that there are no professional people in AA. There are no addictionologists. There are no professional recruiters and this kind of thing in AA. But there's no question that AA works. Non-professionals are capable of giving bad advice, but they're also capable of giving advice that worked. And that's what they do. And there can also be professionals that give bad advice. So that's also a possibility that we don't talk about. Effectiveness of AA. Attrition tends to occur usually within the first 3 to 6 months after starting. I require my patients to attend 3 to 4 meetings a week because that's what AA recommends, and that's quite frankly, what worked for me. So that's what they do. I inform my patients that there is a legal requirement for MAT patients that they have to have counseling, and if they choose to go to meetings, that's what they have to do. I tell them that, that they have to keep a narrative log of their meetings, which they must bring to me with each examination, each office visit. The log is instrumental in documenting growth and identifying problems. The majority of my patients see the benefit of quite rapidly of the log, and they don't have any problem doing it. When I'm asked how long a patient must attend meetings, I tell them they have to go until they want to go. Pure and simple. Does AA work? I don't know. Does MAT work? Do we really know? What happens when we discharge a patient, when we wean them off of Suboxone because they don't want to stay on Suboxone and they look like they're really doing well, and then we don't hear from them again? Do we know that they're still clean? We don't know. AA did a study in 2014 in which they, at random, chose 6,000 members and asked them, how long have you been sober? 27% were sober less than a year, 24% 1 to 5 years, 13% 5 to 10 years, 14% were sober 10 to 20 years, 22% were sober over 20 years. And keep in mind, there are a lot of people who don't attend meetings regularly after 10, 15, 20 years. I don't go as often as I used to go. In fact, I rarely go now. So I wouldn't have been counted in this group of 22%. It would actually be higher if people like myself were still as active as we were when we were only 1 year sober. All these are estimates. No one really knows. Even AA is very modest by their own admission. They feel that between 5 and 10% are sober. Yet, if 22% of the people sober that were surveyed were sober over 20 years, that would indicate that there's probably a higher success rate than that. And lastly, I would encourage you to go online, look at some of the pamphlets from AA. A lot of the information that I've given today came in part from pamphlets. And then, of course, there's another reference there regarding the obstacles. Thank you, and we'll open it up to questions.
Dr. Moss, thank you so much.